Well, the country is currently experiencing some serious influenza wave that is having people talking about whether is it COVID-19 that is back, whereas the officials or the authorities are saying it's no, and the reports are saying some are getting worried. What exactly is happening? And for us to have a clear understanding in terms of what is this wave all about, should you be worried or no? You know what, we do have the Permanent Secretary in the Ministry of Health and Childcare, that is none other than Dr. Aspect Maunganidze, who is here to explain to us what exactly is happening on Affairs the Nation. Good evening, and thank you so much for joining us. My name is Ian Wambe. Dr. Maunganidze, thank you so much for coming through. And let's start by this issue of the influenza. What is happening? Some are getting worried. Is it COVID-19 that is back, or it's a different kind of a virus? Can you just explain what is happening with this influenza?
Thank you very much, Ian. I think it's important as we're coming out from the COVID era. The fears of COVID are still in our population. And whenever we get into any cold season, even when the common cold is going around, people become a bit anxious whether we are now going back to the COVID era or not. What has been noted, I agree with you, there have been some severe cases of flu or flu-like illnesses, and most would then think COVID is back. We do have a disease surveillance unit in the epidemiology disease unit in our ministry, which makes sure that all reports from all clinics with regards to common diseases are reported, tabulated, and if there's any need for investigations, appropriate investigations are done. We have noted as we go into winter, which is common and is typical, that cases of flu-like illnesses, influenza, common colds start to go up. It's known that influenza A and B are seasonal type of causes of the flu. Now, we have noted also that there's been quite a number of cases of people complaining of severe symptoms of that. Tests that have been done so far have not seen any increase in COVID cases. In the recent 4 weeks, we have not detected any COVID case. The last 3 cases which were detected were in end of April into early May, and these were mild cases. So we don't have any evidence to say that we are back to the COVID era, one. We don't have evidence of any new variant of COVID, the SARS-CoV-2, which we all call COVID-19 disease. There's no new variant. When that happens, the WHO will announce that there's a new variant. So the last variant we talk about was the JN1 of the Omicron sub-variant of COVID.
So generally, PEMSEC, you are saying that people should not be worried. This is the usual, the common flu that we are all used to, that we know it will come at some point in a year. Is this what you are essentially saying? We
currently have no evidence to the contrary. In fact, if you're looking at the statistics, by end of May 2023, we had close to 150,000 cases of the common flu. Now we have about 99,000. So we actually have lesser cases in 2024 by end of May compared to 2023. However, indeed, when the cases are severe, people start to worry. And it's important then to know the general symptoms of the common cold, flu or influenza, so that people are able to know when it is appropriate to seek proper medical advice. Otherwise, what we usually get are your running nose, your sore throat, a bit of a headache, a fever, sometimes general body aches, joint aches, and just feeling off the weather. In children, sometimes they also get diarrhea and vomiting as part of the flu symptoms.
So what then should one do when you find yourself complaining of these symptoms? Do you have to isolate? Is this go back to face mask? Are there any specific measures that you believe Zimbabweans should do when they have this influenza?
Yeah, I think what's important is to know the mode of transmission and to know what worsens the situation and to know if you are at risk as a person.
How do you know?
The standard high risks for having major complications from even a common cold include those in young age, the elderly, those who already have illnesses, especially cardiopulmonary illnesses, those who already have asthma, bronchitis, or have heart failure, and those who are bedridden or in communities where, for example, in nursing homes, those who have immunosuppression, their immunity is not very strong, whether induced by drugs or by diseases. They might have their immunity is low. Those who are malnourished. And now with the drug and substance abuse cage we have in the country, we have some who are not even taking care of their nutritional needs because they're always high on drugs. So they become very vulnerable. Those who are socially in circumstances, for example, who live on the streets and so forth, and those who work in the mines with problems in their chest. So all those are high-risk patients. And obviously, they need to make sure that if you are aware of the mode of transmission, these are from droplets, from your airway, through coughing, sneezing, and just ordinary talk. Droplets will be within 1.5 meters of each individual. You'll be dropping some droplets. So the same measures we were taking during COVID are still key even during the common cold, because these droplets will be on the surfaces and in the air. So you want to make sure you still have good hand hygiene. Wash your hands and don't touch your face frequently, because if you have inadvertently gotten some droplets on your hands, it means you then immediately put them close to your nostrils, and then you breathe them, and your risks of getting the infection is high. So we still encourage to wash your hands. And if you are high risk and you can't avoid closed spaces with high numbers of people, and you have already started having symptoms, it's advisable then to wear a mask so that you don't transmit to others. Remember, the ordinary masks are more specific for not transmitting to others, while the other N95s and so forth will prevent transmission to you. But we encourage that if you have symptoms which ordinarily start with sore throat, general malaise, and the highest time for transmitting to others will be a day before the symptoms and about 5 to 7 days after the symptoms have started. So you need to avoid closed spaces where there's a lot of human traffic. If you think you are already exposed, it's best just to wear your mask. If you are caring for those who are immunosuppressed or those who are high risk, like I already mentioned, then it's best to make sure you also wear a mask.
You have shared some important notes in terms of this particular influenza, but let's move on from this particular influenza. The general state of the health sector in Zimbabwe, PEMSEC, are you happy? What is the current state of our health sector in Zimbabwe? Are you satisfied with what we are currently having?
We are coming from the COVID era. We are battling with cholera, although we are now on the winning side, and cholera has been with us.
At what point, PEMSEC, do we stop from coming from the COVID era, or will you always come from the COVID era?
Yeah, what you should understand is COVID had quite a wide range of effects on different facets of our social, economic spheres, and even resource allocation and so forth has been quite trying to cover for all those things. These have an impact which most people will still talk about this COVID 10 years from now. And some of the effects are not just on the physical health, and some will remain on the mental. And quite a number, especially health workers who were taking care of patients in this era.
Frontline workers.
Yes, the frontline workers might go on having challenges with the environment that we lived in. Indeed, we should be able to try as a nation to pick ourselves up from that as soon as we can, because health still needs to be taken care of health of the nation is still need to be taken care of. Now, like I was saying, we have been battling with cholera for some time. Resource allocations would need now to be streamlined. Once you always have an emergency ongoing in the sector, it means some areas might not get the attention you deserve. Now, as we come out of the cholera, we have come out of the COVID. Indeed, we have a challenge of drought, which our president has declared as a national disaster. So it also means some resources will be going towards that. But we expect, as a country, as we come out of all these disasters, that we should see our service delivery in the health sector start to pick up.
You have explained in terms of this general state, but recently your ministry, which is the Ministry of Health and Childcare, reported, I think on the 15th of May, that around 34,000 cases of suspected cases of cholera were recorded throughout the country. Where are we in terms of cholera? Because surely we have a bad record when it comes to cholera. We don't want to look back some of the threatening numbers. We have seen some of the scary numbers. Where are we in as far as cholera is concerned?
So the 35,000, close to 35,000, it's about 34,400 something.
Right.
These are cumulative numbers from the 12th of February last year that we have had the cases of suspected cholera cases.
So it's over a period of close to 14, 15 months?
Yes.
Okay.
And it has gone through various peaks along the way. And the worst peak was when the rain season came. And the nation might want to know that cholera is really a disease that comes out of a poor wash,
right.
Which is your water and sanitation and hygiene scenario. So health tries to pick off from the effects of poor wash. And this comes from unplanned settlements, in particular as our urban areas expand. It might also come from where people don't practice proper hygiene and are not observant to health practices that are proper. And this we saw. Yes.
But you speak of these reasons or causes that you're well aware of.
Yes.
And for example, you say unplanned allocations of stains, for example, locations that are not really on a scale where they are in a position maybe to not to have these diseases. Causes we understand. So what therefore becomes the proactive decisions or programs you're introducing as a ministry to curb that? Because surely we cannot just be aware of the problems, where it's coming from. You know, how best are you also avoiding these problems?
So yes, this needs a whole of government approach because health cannot do it alone. However, we definitely have gone on an exercise to make sure that especially safe water is available in our clinics. We have gone with our partners to drill. In just last year, we have drilled close to 450 bores in our clinics, and we intend to continue with that exercise. We also have gone on a solarization of our health centers, where we have managed to solarize close to 1,200 health centers, and you've got 600 outstanding, and that continues. You understand that once you solarize, you'll be able to pump water, you'll be able to wash your linen with motorized water supplies, and this is very key. If you've got safe water, you have done more than 50%, then you also want now to have safe ablution, handling the waste. And all our health centers, we have gone to make sure that we adhere to that and achieve proper waste management. We are installing incinerators, human waste, which includes biological waste. Also, if it ends up in our water reticulation, we'll increase that cycle of disease. So we are installing big incinerators in our institutions also to take care of that. However, as a whole of government approach, I'm sure you're aware that there's a presidential scheme in terms of drilling bores, both in the rural areas.
In all the 35,000 villages.
Yes, and that will go a long way. Regularization of unplanned settlement is also an ongoing process with local government. So all these are efforts to make sure that we prevent. This is really a disease which should be not in the modern era. In addition to that,
unfortunately, I might have to stop you there. We're going to take a short break, but I will allow you to expand in terms of what we need to do in the 21st century. Surely, like the PEMSAC is saying, there are some diseases we shouldn't be talking about in this 21st century. Don't go anywhere. We're going to take a short break. We will be right back. Thank you so much for staying with us. The program is Face the Nation, and tonight the man facing the nation is none other than the Permanent Secretary in the Ministry of Health and Childcare, that is Dr. Aspect Maunganidze, explaining to us earlier on the influenza that everyone was getting worried about, and now the state of the country's health, generally looking at what the government is doing. Now, before we went for the break, Doctor, you were explaining that there are surely some diseases we can't be talking about in this 21st century. Where are we in terms of ensuring that that conversation is left in the past?
Yes, I think right now, as we move to eradicate cholera, I've said we need to strengthen the WASH pillar. We need, now you must realize that we also went through vaccination of areas that we felt were hotspots. Vaccination only gives an opportunity for you to build on your infrastructure. So it shouldn't be the main key to prevent cholera. But it managed, together with other measures, risk communication with communities. We do have religious objectors. We need to educate them, engage them, so that they see the benefits of modern ways of health service. So that having been done, it will then give us an opportunity to now build on the rest of other pillars of health system to make sure that they are robust, and then we'll be able to deliver the type of healthcare service which is fit for the century that we are in. And key of which is to make sure that all the layers of the health system, from primary healthcare, secondary, to quaternary, which is existing now, but you might be aware that we want to move to the quinary level. And this move has already started with the groundbreaking which happened at the University of Zimbabwe, where Quinary Hospital is being built. However, we still need to strengthen those 4 layers of our system which are existing. And we need to come to a stage where we have medical tourism coming to Zimbabwe, people coming to be operated or to recuperate and enjoy the tourism and the scenery that Zimbabwe has to offer. We need to get to that stage. And for us
let's
to
get back to what you said, some of the limitations in terms of ensuring that we leave some of the diseases in the past. You mentioned religious beliefs as some of the limitations. How best can we circumvent that? How best can we say we are dealing with these religious beliefs as a limitation in terms of access to health for children and even for everyone?
I think there are 2 issues when you are dealing with religious beliefs. Children's rights are enshrined in our constitution.
Right.
So those ones we are mandated to make sure that children get their health taken care of, especially by the state. And you might be aware that all under 5s treatment is free. When we are dealing with where there's objection to modern service, health service, we need to engage. Engagement is very key, because if you don't engage, whatever modality or good intentions that you might have, there will be no compliance. And this is very key. Compliance is key for any treatment to work. If you don't believe you are being treated, most people will say treatment will start in your psychology. If you feel you are comfortable being treated and you are engaged properly, you are likely to disseminate the message in your community. So it's a government's approach to engage the leaders, particularly of the religious objectors. And I must say, during the cholera time, in Manicaland, we had a few spots of serious religious objection, but engagement yielded the results, and now we hardly have cases being reported from Manicaland. And this applies even to immunization, because once you reject any modern health interventions. You also reject even vaccinations and so forth. But we want to make sure that our mortality rate in under 5s continue to go down, as we have managed to do in trying to achieve our SDG 3. In terms of SDG 3, we need to achieve reducing infant mortality, reducing neonatal mortality, maternal mortality, and all those mortalities. As long as you have high religious objection, you probably fail to achieve them. So we have a population which needs serious engagement, and government is there to engage, and both at leadership and right into the community. We need to engage them.
Doc, let's move on to talk about one more interesting issue in terms of your sector. Some people have complained when it comes to power cuts vis-a-vis hospitals and clinics. These are very essential institutions in as far as the provision of health services are concerned. What is the government's position regarding power cuts to hospitals and clinics? Some have lost their relatives, some have lost their wives giving birth. I mean, there's just so much to talk about in terms of that. What are you doing as a government in as far as that is concerned?
Yes, so there is a cabinet position in terms of all health institutions should be on the grid, ideally, and more so.
Ideally?
Yes, yes. Of course, there are some small health posts that we have put on renewable energy, on solar, because the grid hasn't reached those areas. But in general, all those who are online on the ZESA line should be on a line which is direct and is not subjected to the power cuts.
Uninterrupted?
It should be uninterrupted. Centers that are not, we are in the process of making sure we liaise with the Ministry of Energy and through ZESA so that those centers can be capacitated and
so you
online.
You say that is a cabinet position.
Yes.
But what is on the ground? What exactly are we seeing on the ground currently? How many, or do we feel that we have gone beyond maybe half the number of the hospitals we have that are uninterrupted in terms of power supply?
I think so far we are 30 to 40%, but this is work in progress, and we are working on it to make sure that all centers that are on ZESA are on the grid and are not having subjected to power cuts. But in addition, we put backup system, and the major centers are also on generator backup system. We have gone on a solarization of our health centers, starting from those who are off the grid completely, and out of the 1,800 health centers that we, plus or minus 1,800 in the country, we have managed to solarize 1,150, and we continue to on that trajectory to solarize these centers and even move to central hospitals. These are much bigger, and they would need a proper solar plants to take care of all their energy needs on solar. So in those areas, we'll try to earmark certain critical areas, which will start making sure they are on the national grid, making sure they have backup with a generator, and in addition, are solarized. You must be aware that there are certain areas in the hospital that cannot sustain without power.
Without power, yes.
Yes. Vaccines need to maintain their cold chain. You can't have them off the grid for long. And in that line, we have acquired in excess of 1,500 refrigerators specifically for vaccines. The critical care area, if you're on the ventilator, if you're in theater, you can't afford to have the machine dying on you. So all those areas need to be covered. Laboratories where specimens are also stored in fridges need to be covered. So in terms of the big central hospitals, in addition to the ZESA line, in addition to the backup with generator, certain units we also need to put them on solar as we solarize all our health centers.
Interesting you get to say that you are doing so much in as far as that is concerned. You also explained that cholera, so much was done by the government. So when you look at the state of health in Zimbabwe, out of 10, how would you rate yourself?
I think because of the major challenges we've had, I'll put ourselves at 6. because of the major challenges. But I think we have done very well, especially against all these challenges that we have.
60%?
Yes, I think I'll put it that.
Interesting. So now going forward, obviously Zimbabwe is on a quest to become an upper middle income society, and the health sector is definitely key in terms of ensuring that we are all health. How do you feel that the general public can contribute towards that goal in terms of your sector, which is health?
So what we need to achieve, which is what WHO would want all countries to achieve, is at least 80% universal health coverage, so that at all levels you have access to health facilities, you have access to medicines, you have access to... So we need to do this together. It's not just government which has to achieve this. It has to be government together with partners. We have really been there for us. And we couldn't have fought cholera alone. Many partners were on board to set up cholera treatment centers, to educate the population, and to capacitate us as a country. We also need private players to come on board. It is everyone's right, especially in an emergency setup. It's enshrined in our constitution that if it's an emergency, even if you go to a private health facility, should be taken care of. The emergency should be done, and then we talk about money later. And we need to change that narrative so that everyone knows that it's a constitutional right to health, and we need to achieve universal health coverage for people. So all hands should be on deck.
Toku, thank you so much for explaining that, and Zimbabweans might be wondering, do you have a special message you want to share with the nation this evening?
Yes, indeed. It's particularly in this season, we need not to panic. The common cold is upon us, and this is a season which will pass. We need to make sure we adhere to all the health regulations and listen to your health providers so that we stay safe during this winter, and then we will be able to be reinvigorated throughout the winter, and we, as we go forward, make sure that we achieve our universal health coverage. And we should be a concerted effort, and government seriously wants to make sure that we deliver in terms of health service.
And lastly, schools are ongoing, children are going to school. Special message regarding those parents and those who are taking care of these children.
Yes, still they don't need to panic, but make sure you provide warmth. Exposure to cold is also a major risk for getting these common colds. Make sure your kids are warm, provide warm fluids. I advise the institutions, especially for those who are on boarding, to make sure that they provide warm water, they make sure they have hygienic facilities, and make sure the kids in schools wash their hands. If they get sick, they should immediately, especially with this cold, they shouldn't go to school with the cold, particularly the first week. And if symptoms get worse, they should seek medical advice and be treated accordingly.
Thank you so much for sharing those words. These are the words coming through from the Permanent Secretary in the Ministry of Health and Child Care, explaining what you need to do as a parent, what you also need to do as an active Zimbabwean as far as issues around health is concerned, ensuring that you get to stay safe from this influenza. He confirmed it's not COVID-19. Yes, it's just the flu we are all used to. Just do all the precautionary measures you have been doing, washing your hands, ensuring that you do have to have that face mask when there is need. Doctor, thank you so much for coming through, and we truly appreciate it. That's all we had for you on tonight's edition of Face the Nation, where the doctor was explaining, and I'm sure you learned quite a lot. Until we meet again next time, my name is Ian Mambe, and stay tuned to ZBC TV.